Hello, my friends. This is my 10-month post-op update video. If you are new to my channel, I would just want to say thank you for joining. My name is Dylan, and I am from the Chicago suburbs, and I have a condition called Pudendal nerve entrapment syndrome. The pudendal nerve is the main nerve branch that controls the pelvic floor. It is both a sympathetic and an autonomic nerve that controls both conscious and unconscious control of the pelvic organs. It arises from sacral nerve roots S2, S3, and S4, and you have a right-sided and a left-sided pudendal nerve. And I had my left pudendal nerve was entrapped, which basically means that it was caught between a lot of scar tissue and the ligaments. And the surgery is basically, there's a couple different methods for the surgery. The most direct and comprehensive method is the transgluteal method, in which they sever some ligaments through the buttocks and they follow the nerve pathway along its course, and they clear away any scar tissue, inject stem cells for healing, and measure the conductivity of the nerve to see how it's functioning. I had a pretty significant amount of nerve damage when they went in there, so it wasn't functioning to its capacity. And then post decompression, it was functioning a lot better. The surgery is very controversial in a lot of ways. It is a last resort treatment for this condition. Prior to doing surgery, they need you to be in pelvic floor physical therapy, take conservative measures to lifestyle modifications, diet changes, stretching. They want you to try a lot of different medications. They want you to do injections, both to confirm the diagnosis and to see if that is helpful in treatment, as well as muscle injections of the pelvic floor. So there's a lot of different treatment modalities for pudendal neuralgia, and many people suffer for a very long time, unfortunately, before they find any type of relief for this syndrome. There's not a lot of success or research involved with this syndrome because it's so rare and misunderstood. And the surgery, a lot of people say, is a last resort, and it takes up to 2 years to see any improvement, if at all. It's a surgery it's not a guarantee. It's an experimental surgery. And although my surgeon was Dr. Hibner, and he's in Arizona, and he has a lot of experience with this surgery. He's done over 400 pudendal decompression surgeries. He studied in France, and there's a lot more education on surgical approaches and this condition in general over in Europe as opposed to the United States, although we're catching up a little bit. There's other methods to access this nerve that are not as invasive. There's a laparoscopic method overseas that they tend to be doing. There's also the transischiorectal model, which kind of comes at the nerve from only one area, but it misses another area. The pudendal nerve is a very three-dimensional nerve, and it covers a lot of area. And it's very hard to know. It depends on where your doctor believes that the nerve is having issues to decide an approach. If you have nerve issues with the entire pudendal nerve, like I did, they tend to do the most invasive surgery to kind of get at the nerve as much as humanly possible, to clear away as much scar tissue as possible. My medical journey doesn't end there. As time went on, my symptoms kind of got a little weirder, and previous symptoms that I had been ignoring for a long time kind of came back to the forefront a little more after the surgery that I had. In October, I underwent a venogram with intravascular ultrasound, to where they check for vein compressions, and I found that I had multiple vein compressions, pelvic congestion syndrome, moderate nutcrackers, and May-Turner syndrome. May-Turner syndrome is the compression of the iliac vein with the right iliac artery. And a lot of these vein compression syndromes are on the left side. So if you have left-sided pain, it's definitely something to check out prior to having decompression surgery. Also, I did find out multiple doctors and physical therapists agree that I have a genetic condition called Elhers-Danlow Syndrome. It is a weakening of connective tissue, ligaments, blood vessels, joints, and it affects the collagen in your body. And there's a lot of there's collagen that surrounds your entire organ system, that holds up your organs, and it makes people prone to neuropathic pain and musculoskeletal pain. And that's something that I found out probably in about August, September of last year. And it's definitely something that was a game changer for me. I did not know about EDS. I mean, I knew a little about EDS prior to having surgery, but had I known about EDS, it might have changed the course of my treatment plan. I might have been more conservative, because people with EDS tend to have issues with healing from surgeries a lot more so than the general public. They do cut through ligaments, in my case, to access the nerves. So that would have been that's a huge problem, because my ligaments were already weak to begin with, making me more prone to nerve issues. So it would have definitely been a game changer had I known about EDS prior to surgery. Although I don't know if I would have made the decision to go through with the surgery or not, even knowing that information. But at this point, there's nothing I can do but look to the future. There are 14 different types of EDS. The most common type of EDS does not have a genetic test at this moment. They are doing research, and in my lifetime, there will be a test to show hypermobile Ehlers-Danlos syndrome, or even hypermobility spectrum disorder might be something that they would be able to test for. I had a test through Invitae Genetics to determine if I had a variety of connective tissue disorders. There's other connective tissue disorders than EDS that are more rare, that are out there that I could have, that I need to rule out. There are several types of Ehlers-Danlos syndrome that are very severe, or can potentially be very severe, like the vascular types of EDS and the heart valve types of EDS are very severe types of EDS that could cause organ rupture, arterial rupture, things like that. So I am awaiting the results of those genetic tests that will probably be in the next 2 or 3 weeks. So I will keep you guys updated on that. Even if they don't find anything through this genetic testing, at least I'll know exactly what I'm dealing with or not dealing with. Because at this point, if I have a very serious type of EDS, which I may or may not, I need to have a treatment plan. I need to be prepared in case I have an organ rupture or a vessel rupture. So it's definitely worth knowing prior to having to deal with something that serious. So basically that's it. I am 10 months post decompression surgery, and overall with the neuropathic pain and my other symptoms, my GI symptoms, my dysautonomia symptoms, if anything, overall I am worse off than pre-op. I can't drive. I can't wear pants. I had to modify my life completely prior to this surgery. So if you're considering decompression surgery and you have pelvic issues, I would advise you to make sure you have everything lined up. Don't expect to go back to work after the surgery, unless it's maybe a remote job. Don't expect to have the life you had prior to surgery. It's a completely life-changing surgery. And again, if I could go back, I probably would just choose not to have the surgery and kind of cope with my symptoms, or maybe just manage them. There's a couple other options for pelvic pain, like dorsal nerve root ganglion stimulators. There's a bunch of different brands when it comes to the neuromodulation units for pain, and they are improving the equipment every year. So it kind of gives me hope that there might be something that could eventually help me manage my quality of life. The other thing is medication. I have been years and years with trial and error with medication. Some medications I do well with, others I don't notice much of a difference. So I'm trying to decide which medication to be on. There's a drug called low-dose naltrexone that I'm going to try at some point. There's a lot of studies with that involving immunology, immune system disorders, which I don't believe I have, but I probably have as a secondary issue. Inflammation is an issue with people in pain, with pain syndromes. So that's something that that's probably on the horizon for me to try. So that's pretty much it for 10 months. Thank you guys for listening to my long and rambling videos, and I will talk to you again in a week.